Have you ever woken up in the middle of the night, not once but 2 or 3 times, wondering why your body refuses to rest even when your mind is exhausted? In the silence of the night, when the world is asleep and darkness wraps around your home like a quiet blanket, your body may be trying to whisper something important to you. Many people dismiss frequent nighttime urination as a small inconvenience, a minor irritation that comes with age or extra water before bed. But what if it is more than that? What if this repeated interruption of sleep is not random at all, but a signal, a message from within, asking for attention before something deeper begins to unfold? Chronic kidney disease does not always announce itself with dramatic pain or visible suffering. It often begins quietly, subtly, patiently waiting while small changes take place inside the body. Nocturia, the need to urinate more often at night, can be one of those early changes. It may seem harmless, yet it can reflect a shift in how your kidneys are functioning. Healthy kidneys are remarkable organs. They work tirelessly, balancing fluids, filtering waste, and maintaining harmony in your bloodstream. During the night, they naturally reduce urine production so you can rest without disruption. However, when kidney function begins to decline, this delicate balance starts to change. The kidneys gradually lose their ability to concentrate urine effectively. Instead of conserving water and producing smaller amounts of concentrated urine, they allow more diluted urine to pass, especially at night. This is not merely a physical process. It is a reminder that your body depends on intricate systems working in unity. When one system weakens, even slightly, the effects ripple outward. Dr. Matthew R. Weir has often emphasized through his educational work that early recognition of kidney disease symptoms can transform outcomes, because awareness leads to timely action. Understanding why CKD patients urinate more at night is not about fear. It is about awakening. It is about realizing that small signs matter. Every interruption in your sleep may carry information. Every repeated trip to the bathroom may represent an opportunity to listen more closely to your health. Too often, people wait for loud symptoms before they seek guidance. But kidney disease teaches us a different lesson. It teaches patience, subtlety, and the power of early awareness. When you begin to understand how your kidneys lose their concentrating ability, you begin to see that nocturia is not simply an annoyance, but a reflection of internal imbalance. The body produces larger volumes of diluted urine because it can no longer regulate fluid with the same precision. This shift can occur gradually, without pain, without warning, without dramatic signals. That is why knowledge becomes strength. Education becomes empowerment. Recognizing nocturia as a potential early symptom encourages individuals to consult healthcare professionals before the disease progresses further. It opens the door to early diagnosis, lifestyle adjustments, medical management, and hope. The night, once seen as an inconvenience, becomes a messenger. Instead of ignoring it, you begin to ask questions. Instead of assuming it is normal, you begin to explore possibilities. In doing so, you reclaim control. You move from passive acceptance to active awareness. And in that awareness lies the beginning of transformation. Because when you listen to your body's quiet whispers before they become desperate cries, you give yourself the greatest gift of all, the chance to act early, wisely, and with purpose. As the pattern continues night after night, something deeper begins to unfold beneath the surface of what seems like a simple disruption. Sleep becomes fragmented, energy begins to fade, and mornings feel heavier than they once did. At first, it is easy to blame stress, aging, or daily fatigue. Yet within this quiet cycle lies a powerful truth about how the body adapts when the kidneys struggle to perform their full role. When kidney function declines, the intricate filters that once balanced minerals, fluids, and waste lose efficiency. The ability to concentrate urine depends on a complex system of microscopic structures working in harmony, reclaiming water and maintaining equilibrium. When those structures weaken, the kidneys can no longer conserve fluid as effectively, especially during the night when the body expects rest and restoration. Instead of producing a small, concentrated amount of urine, they release larger volumes of diluted fluid. This is not random. It is a physiological shift that reflects deeper internal strain. What makes this reality unsettling is not merely the act of waking up, but the realization that the body often adapts silently while damage progresses gradually. Chronic kidney disease does not rush. It advances patiently, sometimes without pain, sometimes without dramatic warning. And here is where suspense enters the story of health. What if the very symptom you are tempted to ignore is the earliest opportunity to prevent something far more serious? Imagine the possibility that your nightly interruption is not an enemy, but a protective signal. The kidneys, though impaired, are still working. They are still filtering. They are still trying. But they are revealing their struggle through subtle imbalance. Dr. Matthew R. Weir has consistently highlighted in his teachings that awareness of early symptoms can shift the trajectory of kidney disease entirely, because recognition leads to evaluation, and evaluation opens the door to intervention. The difference between progression and preservation often lies in timing. When individuals dismiss nocturia as trivial, valuable time may slip away unnoticed. Yet when they pause and reflect, when they seek professional guidance, when they allow medical evaluation to uncover underlying causes, they step into a position of strength. Suspense builds not because the future is predetermined, but because it is uncertain. Will the signal be ignored, or will it be understood? The body does not speak in dramatic language at first. It communicates through patterns, rhythms, and repeated signals. Frequent nighttime urination may coexist with other subtle changes, such as mild swelling, slight increases in blood pressure, or unexplained fatigue. Each sign alone may seem insignificant. Together, they form a narrative. The kidneys are guardians of internal balance. They regulate sodium, potassium, acid levels, and fluid distribution with extraordinary precision. When that precision begins to decline, the effects extend beyond urine output. Sleep disruption affects mental clarity. Fatigue influences motivation. Subtle fluid imbalance can impact the heart and blood vessels. What begins as a nighttime inconvenience can ripple into daytime performance and overall well-being. Yet within this unfolding challenge lies empowerment. Early recognition allows for lifestyle modifications, medical therapy, dietary adjustments, and consistent monitoring. It allows individuals to slow progression and preserve kidney function for as long as possible. The suspense of uncertainty transforms into the confidence of action. Instead of fearing what might happen, one begins to focus on what can be done. This shift in perspective is powerful. It transforms anxiety into awareness, and awareness into responsibility. The night no longer represents helplessness, but opportunity. Every awakening becomes a reminder to pay attention, to schedule a checkup, to measure kidney function through appropriate testing, and to protect what remains healthy. The story of nocturia in chronic kidney disease is not solely about biology. It is about timing, attention, and the courage to respond before silent damage becomes irreversible. There comes a decisive moment in every health journey when awareness either transforms into action or dissolves into neglect, and that moment often arrives quietly, without drama, without noise, without urgency, strong enough to force change. The repeated awakening in the night can either become a source of frustration or a turning point of responsibility. When you begin to understand that your body is not working against you, but communicating with you, your perspective shifts from irritation to intention. Chronic kidney disease does not define a person's future, but the response to its early signs can shape that future profoundly. The kidneys, though small in size, carry immense responsibility, filtering blood continuously, balancing electrolytes, regulating blood pressure, and sustaining life through precise internal chemistry. When their concentrating ability weakens, nocturia emerges as a visible reflection of invisible strain. Yet within that strain lies possibility. Medical science has advanced remarkably, offering diagnostic tools, laboratory assessments, and therapeutic strategies capable of slowing progression when intervention begins early. This is why education matters. This is why listening matters. This is why the teachings associated with Dr. Matthew R. Weir continue to inspire awareness around early detection and proactive management, because understanding that subtle symptoms deserve attention can protect long-term health. Fear alone does not create change. Clarity does. When individuals recognize nocturia as a potential early signal, rather than an isolated inconvenience. They empower themselves to seek evaluation, monitor kidney function, adjust nutrition, manage blood pressure, control blood sugar, and adopt healthier routines. These actions are not dramatic, but they are transformative. The suspense that once surrounded uncertainty begins to dissolve as knowledge replaces doubt. Instead of wondering what is happening inside the body, you begin to measure, track, and respond. Laboratory tests reveal glomerular filtration rate. Urine analysis uncovers protein presence, and healthcare guidance provides direction. The unknown becomes known. The invisible becomes visible. And in that visibility lies control. Sleep, once disrupted without meaning, regains purpose because it served as an early alarm rather than a late consequence. The journey of managing chronic kidney disease is not about perfection, it is about persistence. It is about consistent monitoring, informed decisions, and small daily commitments that accumulate into stability. Even lifestyle adjustments, such as moderating salt intake, staying properly hydrated under medical guidance, engaging in regular physical activity, and attending routine checkups can significantly influence outcomes. What once felt like vulnerability becomes vigilance. What once felt like weakness becomes wisdom. Nocturia, when understood, becomes a teacher. It teaches that the body whispers before it screams. It teaches that prevention is more powerful than repair. It teaches that time, when respected, can be an ally rather than an adversary. And above all, it teaches that health is a partnership between awareness and action. You are not powerless in the face of early kidney changes. You are not destined to remain uncertain. You are capable of choosing evaluation over assumption and responsibility over avoidance. In doing so, you honor the complexity of your body and the resilience it still carries. The night interruptions that once felt meaningless become symbols of opportunity, reminders that early detection can preserve quality of life and extend stability for years to come. When knowledge guides behavior, outcomes improve. When attention replaces denial, progress slows. And when motivation fuels consistency, hope strengthens. Let this understanding inspire vigilance, not fear, discipline, not anxiety, and action, not delay. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.